Hi there, in this video we are going to discuss another hallmark of carcinogenesis, which is invasion and metastasis. So what happens when tumor grow? They basically invade the surrounding tissues and as well as they can spread to the distant site, which is the process of metastasis. So what happens in the very first step of the metastasis? What happens? There is loosening of the cellular contacts with each other. We know that cells are joined together by proteins. These are the cells and these are the connection between cells. These are basically A-cadherin proteins. And these cellular proteins are joined inside on the cytosolic site with the another protein which is termed as beta-catenin protein, which holds the cytosolic side of this protein. This protein basically holds these normal cells together. However, in cancer cells, what happens? These cellular connections are lost. These cellular connections are lost. When these connections are lost, cell become mobile, or they become able to move regardless of their surrounding cells. So what happens after losing these cellular contacts? Cells start invading their surrounding tissues and degrade the extracellular matrix. Supposedly these were the cells here, and what happens? There is extracellular matrix between these cells, and what happens when a cell becomes freely movable? It start dissolving this extracellular matrix, and among the cell there is basement membrane, we know that, which is composed of collagen, fibronectin and other proteins. These cells secrete enzymes which include metalloproteinases and multiple protease, gelatinases and so on. And these enzymes, what they do, they start digesting this basement membrane also. Supposedly these tumor cells arise from epithelium. So these epithelial cells, first they lose their cellular contacts and then they start invading the basement membrane of epithelium by their enzyme including metalloproteinases and collagenases and proteases. And these enzymes can be secreted by tumor cell as well as they can be secreted by extracellular matrix by complex interaction between tumor cell and extracellular matrix proteins. And what happens in addition, they destroy this basement membrane, they separate to the extracellular matrix and other surrounding tissues, and in this process they can attach to various proteins and cellular markers which are present on the extracellular compartment or other tissues. And what happens in the next phase? Supposedly here lies a blood vessel. These tumor cells come here and this tumor cell start invading the blood vessel wall and enters into the blood vessel, and it can travel in the blood as a sole cell, or it can interact with the platelets and other components in the plasma and can lead to formation of metastatic embolus, which travels to the distant site, and on distant site it can invade the vessel wall again and can extravasate and can settle at the distant site, which is the homing of the carcinoma. So distant site of metastasis also depend upon certain factors, which is anatomical location of the tumor. It is basically understandable that the tumor will mostly invade and metastasize to its nearby location. However, there is also an important factor which is vascular drainage. Vascular drainage plays an important role in tumor metastasis. Tumor enters into the blood vessel as well as lymphatic vessels and gets settled in the next other tissues. In case of blood or hematogenous spread, most common site of settlement is the first vascular bed. For example, the tumor is rising from GID region, settle into the liver because they encounter first capillary bed in the liver. And moreover, certain tumors which enter in the vena cava and go to heart, they settle in the lungs because the first capillary bed they encounter is in lungs. So lungs and the liver are the most common site of the secondary mets. Next is also tropism of tumor. It is basically a process in which tumor gets attached to specific antigen or specific proteins or markers expressed in specific tissues. For example, lung carcinoma spreads, lung cancer preferably spreads to the adrenal glands. It shows basically a process of tropism. Adrenal gland have some certain kinds of the you can say proteins or markers which cause this carcinoma to settle into the adrenals. Moreover, in the very same way, prostatic carcinoma prostatic CS spreads to the bones, and this is also due to a process of tropism and so on. So basically, metastasis involves the process of first there is loosening of cellular contacts, then it invades the surrounding tissue its own basement membrane and degrades the extracellular matrix, and it also gets attached to specific extracellular matrix protein or markers. Then it shows the process of intravasation. Intravasation will basically process in which tumor enters into the blood vessel and it travels to distant site. Then show the process of extravasation in which it moves out of the blood vessel, and then there is homing at the distant site. You can see this at this diagram here, which explains the entire process very well. You can look here. This is the tumor cells, and there's clonal expansion. A specific clone or specific cell grows and divides and produces a metastatic clone or subclone. This subclone, what is it is doing? It invade here basement membrane. It destroys its parent tissue basement membrane. It enters the extracellular space and interacts with other cells and extracellular matrix proteins. Then it comes in the vicinity of blood vessel. It then invades the blood vessel wall and enters into blood, and then it forms a it can travel as a soul cells, or it can form a kind of embolus. Then it moves on here. Then it shows the process of extravasation, and after the extravasation it can form a metastatic tumor or deposit at the distant site. So this is the process of basically invasion and metastasis. This motility of the carcinoma is controlled by certain autocrine factors and certain you can say chemokines which are released by both extracellular matrix as well as tumor cells, and form basically a kind of, you can say, pathway or a chemoattractant pathway which leads to the mobility of the tumor cells. So this was basically an overview. However, the distant site or site of settlement depends upon tropism, depends upon anatomical location, depends upon drainage. However, it is not always true. For example, skeletal muscles and spleen. Skeletal muscles and spleen are rare site of metastasis. It can be due to their unfavorable site for the metastasis because they are rich in capillary beds. However, tumors rarely settle them there because basically tumor carcinogenesis and tumors don't follow usually the rules here. So it is we can predict to some extent that a particle tumor spreads to which side. However, we cannot say with certainty always that at which side it is going to settle. Moreover, there are certain tumors which have more metastatic potential. However, certain tumors don't have metastatic potential. For example, lung, small cell carcinoma of lung always loves to small cell carcinoma of lung always loves to metastasize. However, the basal cell carcinoma of the skin usually does not show metastasis. However, certain tumors show metastasis at an early stage, certain tumors show it at a very late stage. So it is basically a complex response of the tumor cell to the different factors which are under the research and also require thorough research and investigation to understand these complex process of carcinogenesis. So it was all about today's lecture, and you can use that diagram for your understanding and learning and summary of the topic for your learning. That would be enough. Thank you.